Hi, so this is Sunday the 26th of August 2018. I'm back home after open liver surgery, so I'm just going to talk a bit about what happened in the surgery and what may happen now. Surgery was 13 days ago on the 13th, and I had to have the surgery because a couple of months ago I had a CT scan, which is just a regular CT scan I have every 3 months to check how the chemotherapy is going. And to my great surprise and the surprise of the doctors, the cancer in my liver had grown massively when it should have almost disappeared, or pretty much have disappeared at that point from the proton beam therapy. So that showed that, unfortunately, proton beam therapy didn't work for me and my chemotherapy had stopped working. So the radiologist who did the proton beam therapy suggested what's called salvage surgery. So this is like surgery for when another treatment's failed, I guess. It was pretty dangerous because the proton beam therapy, when it goes through the liver becomes harder, called liver fibrosis. And hard liver, when you cut it, it bleeds a lot. It's very hard to stop the bleeding. So this is going to be a pretty dangerous liver surgery, and probably most liver surgeons in Japan would not have agreed to do it. But the hospital where I had the proton beam therapy, they have had experience of doing liver surgery for patients who have had proton beam therapy or other kind of radiation treatment. So they were relatively confident they could do the surgery. It's incredibly hot here, so I've got to put a fan on. Hopefully the audio will still be okay. One of the big issues was whether the cancer had spread out of my liver to the diaphragm, which is the muscle under your lungs that allows you to breathe, and also my right kidney. It wasn't clear on the scans, so it would only be discovered during surgery. So that was a big concern. There was a new liver tumour near my gallbladder, which meant that the liver surgeon had to remove the gallbladder as well. And the day before the liver surgery, I had another CT scan, and it was found that there was tumour near the portal vein. So the liver is unique in the body, and it has two blood supplies. So veins don't supply blood to organs. The veins take the blood back to the heart. The organs are supplied by arteries, but the liver has hepatic artery and also this thing called the portal vein, so the dual blood supply. It's one of the reasons why cancer loves, why it's so common for cancer to spread to the liver. As cancers are growing, they're always looking for new blood supplies. That's why when you look at cancer tumours, they tend to be quite sort of fuzzy shapes. Non-cancerous tumours tend to be quite round, and the reason they're fuzzy is because they're growing towards a blood supply. So because the tumour was close to the portal artery, to get to the tumour, the liver surgeon would have to cut some of the blood vessels around the portal artery, portal vein, sorry. And that would mean that that area of the liver would have no blood supply, or would have a limited blood supply, and would eventually die. So, which is it's bad to have dead tissue in your body, necrotic tissue. So, unfortunately, it meant the surgeon had to cut away a lot of the healthy tissue around the portal vein to prevent it becoming necrotic in the future. So, instead of taking sort of, I don't know what it would have been, 15-20% of the liver, which is the cancerous bit, I think the liver surgeon took closer to like half, plus the gallbladder as well. You don't need a gallbladder. The liver produces bile, which goes into your stomach for digestion, and the bile collects in this organ called the gallbladder. And I think it's from a time when primitive humans would have had maybe a less efficient stomach, smaller stomach, and we would have eaten a lot of uncooked food, I guess. So we needed a lot more bile to digest our food. Or maybe it's the other way around. Maybe the liver in primitive humans was smaller or less efficient at making bile. So anyway, in the past, it was necessary for kind of bile to collect in the gallbladder and go into your stomach. But human liver now produces plenty of bile in comparison to what we eat. So gallbladder is an unnecessary organ, a bit like the appendix, which the appendix possibly made enzymes to break down, or enzymes and other substances to break down cellulose. Humans are not able to eat cellulose at the moment, but perhaps were in the past. Anyway, so I had to have quite a lot of my liver removed, and so I had the surgery on Monday the 13th of August. Woke up in intensive care, vomited straight away in my oxygen mask, which was very unpleasant and incredibly painful, because any kind of retching movement with when you've had a big surgical incision, any kind of cough, hiccups, incredibly painful. So yeah, I had a very, very, very unpleasant night in intensive care, basically screaming every few minutes. It was really funny that the nurse call system in intensive care in this hospital consisted of like a little pair of bells that they put in your hand. I guess they just found from experience that was more effective than the usual nurse call system of a button that you press, that's kind of on the end of a wire that you hold. So anyway, I kept pressing that, and they came and gave me as much painkillers as I could handle. It was a very, very long day and night, and a day, I guess. The surgery took 7 hours, and there was no chance of sleeping after, so I was in so much pain, and in a very uncomfortable position. So what I tried to do is kind of watch films in my head, all the films I could think of, and TV programs. It was a very, very, very long time. Anyway, I got discharged from that and went to the ward. At this hospital, the ward I was on consisted of private rooms, which was really nice. Made a big, big difference having a private room. So the hospital is in the north of Japan. It's called the Southern Tohoku General Hospital. Tohoku is the region of Japan, from an hour and a bit north of Tokyo by bullet train. It's an amazing hospital. It's the highest technology hospital in Japan, and it's now there's a whole group of. It's now like a medical group, the Southern Tohoku Medical Group, with a couple of hospitals in Tokyo, a clinic in Tokyo, and some other places elsewhere. Very, very, very good technology. Staff are very good as well. And lovely hospital. Very annoying that it's an hour and a half from Tokyo Station by bullet train. So, but I did have a couple of visitors, which I was massively appreciative of. My friend Ayako and also my friend Stuart both came to see me, which made a big difference. Recovery was fine for the first couple of days, and then I got a collapsed lung and pneumonia and a blood infection. The reason I got a blood infection was I had a drip in my neck and that became infected. It's quite usual for drips to become infected after major surgery. So I had a drip in my neck. I had a heart monitor catheter thing in my wrist, I think. I had 3 surgical drains in my abdomen and a urinary catheter as well. Another thing is I had an oxygen mask, but even the biggest oxygen mask was a little bit too small, and after a couple of days they replaced that with one of the, like, just a tube that kind of goes there with 2 bits that stick in your nose. But because that was too small, the kind of tubes irritated the lining of my nose, and I got lots of bleeding from my nose, and that was very unpleasant. So it was fine for like a couple of days, and then had all that stuff happening and went into kind of clinical shock a couple of times, which was incredibly scary. Oh yeah, that's something I remember. When I came out of surgery, for some reason I was incredibly cold and shivering, and my teeth were smashing together. I was really frightened of my teeth breaking or of biting my tongue off. And that happened again when I had the clinical shock from my body temperature went up to kind of close to 40 degrees. I think it was like 39.8 or something. 40 degrees is very, very serious for reasons I don't actually understand. Your muscles try and make your body hotter at that point, and you basically die. So that was, really, really bad. And I remember at a point a male nurse came in, and he was desperately trying to do a blood test, but my body was kind of shaking around, convulsing. So he was trying to take a blood sample from my left arm, and the surgeon came in, very young surgeon. He was trying to get another drip in, and to, I think, put something in to bring down the fever and stop me convulsing. But the whole bed is shaking, my teeth are smashing together, my whole body is shaking, and I've narrow blood vessels in my arms. So about half of people have narrow blood vessels. So it's very hard to get any kind of place to put a temporary drip in. So he eventually went for the inner thigh muscle, put in something which I think brought down the fever and stopped me shaking around. But from then on, I had to have a drip in the back of my hand because you cannot see, unfortunately. Let's see. Yeah, you can kind of see where the sort of the various places where needles had gone in my arm, they'd all kind of collapsed and the blood vessels had burst and things, which I remember happening a couple of years ago when I had my first cancer surgery. So the blood vessels in the back of your hands tend to be quite available. You often see blood vessels in the back of your hands, but it's a very painful place to have a drip. So for the next week or so, I had the drip there. The needle, not the cannula, whatever it's called, it's kind of close to the joints. It's painful to move my hands around or right hand around. But anyway, after a while, fever was okay, drains were removed, had a lot of antibiotics that sorted out the blood infection and was also treated for the pneumonia, had chest x-rays and CT scans, and everything was okay. And I got released from hospital yesterday. Unfortunately, a few days ago while I was still in hospital, we had the lab report. So during the surgery, the surgeon is sending samples to the lab for kind of quick testing. It takes about 15 minutes, I believe. So the surgeons, in my case there were two surgeons, they're taking tumour samples, sending them to the lab. But ultimately the tumour tissue, and particularly the samples from around where the tumours are taken, what's called the margins, they have to be tested in the pathology lab. And the lab result was basically that it seems the surgeons were able to get all the cancer out of my liver, so the margins from where they cut the tumours, the test results from those are that they were cancer free. Unfortunately, so during the surgery, one of the surgeons checked the membrane of my abdomen, called the peritoneum, and he said he couldn't see any tumours there. He couldn't feel any tumours or any hardening, but he washed the membrane and then analysed that liquid, and the pathology report confirmed that that liquid had cancer in. So I think that means there's the cancer cells stuck all over that membrane that haven't formed tumours but are there. So that's extremely bad news, because it means quite soon I'm going to get more cancer. The cancer will come back. And I don't, at this stage, there really aren't other options to try. I've got essentially one chemotherapy left. So I'll probably restart chemotherapy in about a month's time, and just at the moment I'm going to have a 1 week break and then go and visit some doctors again and just look for whatever options I can just anything I can find. But yeah, at this stage, unfortunately, there are no kind of major options left to try, really. If I can get some more funding, then more immunotherapy is probably the most likely thing. So I've been having these two kinds of immunotherapy: NK cell immunotherapy and dendritic cell immunotherapy. NK cell immunotherapy is made with my own blood. Well, in fact, they both are. But the dendritic cell immunotherapy, that's trained for attacking cancer. But in my case, I think it's been trained with generic colon cancer cells that you get from a lab supply place, or I don't really know how it works. But this time I'll be able to have dendritic cell immunotherapy, but using cells that have been trained with the tumour tissue that was removed from my liver. So in theory, it should work much, much, much better. So that's kind of one glimmer of hope, is have dendritic cell immunotherapy, and hopefully that might keep the cancer under control for a bit longer. If not, it's just a case of seeing if I can live long enough for new treatments. There are these treatments coming out, these immune checkpoint inhibitors. Keytruda is the most famous one, I think, and Opdivo. But unfortunately, I had my tumour tested for that after the surgery, and I came out as what's called microsatellite stable. So those, at the moment, those treatments are very unlikely to work for me, not really worth trying because they're a bit risky, causing kidney failure and liver failure. But maybe using them in a combination with another drug might work, something called an MEK inhibitor, MEK inhibitor. So that's really what's happening now. So a week's rest, and then back to see the surgeon just to check that the surgery has wounds all healing up nicely, and then meet some oncologists and my immunotherapist, and just see if there's anything else I can do to live it a little bit longer, because at the moment I'm essentially out of options. Okay, please subscribe to this video. That helps a lot. Just hit the subscribe button on YouTube. More people who subscribe means that YouTube shows my videos to more people, and maybe these videos are very useful to other people who have just been diagnosed with cancer, so you'd be helping out people by subscribing. So please click subscribe, and leave a comment if you have time. I really appreciate the comments and questions a lot. Cheers.